Welcome to today's press briefing. The doctors we have today are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Larry Lee, Chief Manager of HA. Dr. Au will tell us about the latest situation. Good afternoon, members of the public and media friends. Now I shall report to you the new cases reported on the 4th of May, that is yesterday. Yesterday, from PCR test, we have confirmed 148 cases, including 37 cases reported by HA, 10 from the Public Services Laboratory, and the remaining 101 cases were reported by private labs. In terms of RAT, yesterday we have recorded 173 RAT positive cases reported via online platforms and other means. Altogether, we had 321 new cases yesterday. So far, in the 5th wave, we have recorded 1.193786 million cases, including 746,451 cases and 446,545 cases reported via RAT. Among the cases yesterday, 17 were imported. The remaining 304 were locally infected. Among the imported cases, 12 were identified at the temporary specimen collection center at the airport, including two cases arrived at Hong Kong on the 3rd of May via NH811 from the US and Canada. One case arrived at Hong Kong on the 3rd of May via KE607 from Korea. One case arrived at Hong Kong on the 4th of May via TR980 from Singapore. One arrived at Hong Kong on the 4th of May via BR867 from Taiwan. One arrived on the 4th via SQ882 from Singapore, and 4 arrived at Hong Kong on the 4th of May via QR818. The passengers were from Italy and 3 from Denmark. Another passenger arrived at Hong Kong on the 4th via SQ894 from Singapore, and the last one was from ET608 from Thailand on the 4th. Today we have 5 cases identified during quarantine, 1 on the 3rd day via PCR, 1 on the 4th day via RAT, and 2 on the 5th day via PCR and RAT. The last case was confirmed on the 6th day via PCR. Among them, 2 were from France and 3 from Singapore. In terms of genome sequencing, yesterday the Public Services Laboratory performed sequencing for 73 samples. No L452R positive samples were found. 72 samples were found to be negative on L452R, and the remaining 1 case was unconfirmed because of a low viral load. For care homes, 1 elderly care home has reported a new case, that is a resident. For schools, 2,300 schools have resumed in-person classes. 722,000 students and more than 120,000 teachers and staff have been tested before going to school. Among them, this morning, 26 new cases were reported by schools involving 24 students and 2 teachers and staff members. Among them, 21 were confirmed via RAT, 5 via PCR tests. They were a staff from a kindergarten, 14 students from 13 primary schools, and 10 secondary students from 11 secondary schools. In 1 primary school, there were 2 students infected. For the remaining schools, only 1 case was reported. For that primary school with 2 infected cases, the 2 cases are siblings from the same family. They are epidemiologically linked, but they go to different classes. Now, 10 cases were had their sample taken yesterday, and five cases had their sample taken on the 3rd of May. Among them, 26 cases haven't been to school after the holiday, and all the positive cases that did not go to school today. For death cases, so far in the 5th wave, we have 9,120 death cases, and an additional 5 cases compared with yesterday. The mortality rate remains at 0.76%. For those above 80 years old, that is at 10.46%. The vaccination analysis and age distribution is similar with before. Dr. Lee will tell us about the HA situation. Good afternoon. 1,068 confirmed patients are undergoing treatment in public hospitals, North Lantau Infection Control Center, and our Infection Control Center. One patient was reported to be critical yesterday. He received 2 doses, 3 serious patients, and 4 critical patients are in ICUs. And we have also reported 5 patients who have passed away yesterday, including 2 males and 3 females, 4 aged between 86 and 97. Among the patients passed away yesterday, 1 was from care home, 3 did not have vaccination record, 1 got 1 dose, and 2 patients had 2 doses. We are unclear about the age of a deceased patient who was sent to the A&ED. I would like to report to you about the details of this case. The patient was found to be unconscious on the street. The patient was rushed to the Caritas Medical Center. That was 4:52 a.m. On the 4th. The patient had vomit. The Glasgow index was 6. Blood pressure was high, and the irises were asymmetrical. These indicated a brain hemorrhage, and a scanning confirmed that. Upon admission, he was tested PCR positive with CT value 34.2. The patient was sent to the brain department of the Kwama Hospital. Intubation was performed, and drugs were given. His situation deteriorated, and the patient passed away in the small hours of the 4th. Yesterday, 152 patients recovered, including 99 discharged patients. So far in the 5th wave, 48,484 patients are recovered, with most of them discharged. Since year 2020, 60,199 patients have been discharged. Today, no patients were found to be positive on admission. For staff, 22,000 staff have recovered, and most of them have returned to their positions. Thank you. Now we will open the floor for questions. Please identify your media organization before you ask questions.
邊位想？
AM 7:30. I'd like to ask, yesterday there was a man who landed in Hong Kong from Indonesia, and he was infected last March, so he was reinfected after 13 months. What do you how would you comment on that? And FEHD said that the people need not be quarantined after infection, after 3 months of infection. Now, you said there's a lag in the disclosure of information. Could you elaborate a little bit? So do they need to extend the quarantine period? If there are cases like just now, if it's not within 3 months, do they still need to be sent to quarantine? And if they are reinfected, do they need to be sent to the quarantine hotels? And The HA, you said that there were the deceased person, you don't know their age. Could you give us a range? They fainted on the street, or did they faint on the sidewalk, or were they discovered by other pedestrians? Could you disclose a bit more? Thank you for the question. First question about an imported case on the discovered on the 12th day in the community center. Now, we did some investigation. This patient disclosed that in March last year they were infected in Indonesia, and subsequently they stayed in Indonesia. On this occasion, on 19th, they landed in Hong Kong from Indonesia on 19th of April. And during quarantine in the hotel, their sample was negative. And on the 12th day, that is on 30th of April, the sample was uncertain. And we sent the sample to the public laboratory and found it positive. But the virus level is very low. So typically for reinfected cases, typically after months or within 6 months, this scenario will appear, that is, they have residual levels of the virus. So there's two possibilities. There might be a second infection. Last March, Omicron was not prevalent, and he was reinfected recently, and he was not aware that he was infected. So that is a possibility. So we will conduct a DNA analysis, but the virus level is too low. We might not be able to get some hard data. Your second question about the airport, if there are suspected reinfected cases, we have to investigate whether the tourist has any recent positive record. As I said, if it's a reinfected case, typically it can be detected within a few months of infection. Now, if they are detected positive, it might be a second infection, so we will not rule these cases as reinfected cases. So if they were infected within 3 months, and when they arrive in Hong Kong, when we take a sample and the CT level is very high, then we might suspect it is a reinfected case. But all these tourists, they have to be quarantined at least 7 days in the quarantine hotel. During quarantine, we require a RAT test every day, and on the 5th day, we'll conduct a PCR test. If the CT value is very high, we can classify it as a reinfected case. It's possible that they were reinfected, but this is an exceptional case. It has been a lapse of more than 1 year. Regarding the patient with unconfirmed age, he was found on the street, and his index was only 6. So regarding the age, it's very hard to determine the range. According to the emergency reports, we don't think it is a senior citizen, so it is within the range I described just now. TVB. So we are relaxing the social distancing rules. So how do you assess community infection risk? Do we have a mechanism, because we have mainland health workers who are departing? If there is another wave, the mainland medical professionals, will they return to Hong Kong? And today you said that there were 2 siblings infected. The 2 siblings are primary school students. Do you have more details? Let me answer the first and third question, and Dr. Lee can respond to the second question. Regarding the trends, we see that in the last 5 days, the daily figures hover around 300 cases, and there is some volatility from day to day. This range is about 30-40 cases. The situation is stable, and we see that there is a downward trend. if you look at the last 7 days, the daily case, it ranges from 100 plus to 360 cases. And if you compare that to the previous 7 days, the range is 340 to 540 cases. The average is 449. We see a 30% decrease. So the daily figures can range quite significantly. So it's hard to determine the overall trend. We have to monitor the situation. So aside from daily figures, we do see that it is stable, including our wastewater tests, the positive sample ratio, the mandatory testing of residents, and our community center samples. These are all stable, and we don't see a rebound or an upward trend. But the level of 300 cases is still a high level, and compared to the second wave, third wave, and fourth wave at its peak, it is still double those levels. So we have to be careful. When we relax the social distancing measures, there is still room for change. We have a long weekend coming and Mother's Day. There might be family gatherings. So this might lead to a spread of the disease because we do have transmission vectors in the community. So the public needs to stay vigilant. They need to conduct testing, especially for the elderly. They need to have early detection. Dr. Lee? Right now, we don't have a mechanism regarding mainland medical support when they will return to Hong Kong. But as a preparatory measure, the mainland medical team, they will play a pivotal role in our community quarantine mechanism. So after this experience, we've laid solid foundation. So I think the mainland support team, if necessary, the interface or the deployment can be made much smoother. Ming Pao, first of all, for the deceased person of unconfirmed age, did he have any chronic diseases? What was the reason for a brain hemorrhage? Why were you not able to determine his age? And I also want to ask CHPHA, the elderly homes have asked since 12th of April whether there were confirmed cases they have to report to HA, and the industry feels that the cases have come down. So this new requirement is adding to their administrative burden. Some elderly homes also say that the Northwest Cluster report regarding remote management, there are some hiccups in the arrangement. So do you require staff to have RAT tests every day? And lastly, the HA, the AstraZeneca medication, how many patients in Hong Kong require AstraZeneca vaccination? And how much of the AstraZeneca medication do we have in Hong Kong? And who are the first patients receiving the treatment, and what are the effects? So when patients use AstraZeneca, do they need to conduct testing for antibody levels?
On the question about the deceased patients whose age is unknown, we don't have further information on the patient's medical history. The identity is not confirmed still. In terms of a brain hemorrhage patient, scientifically speaking, there are several possibilities. First, the chronic hypertension leads to a blood vessel edema. For AstraZeneca, we have received the first batch of medication. We have some 190 doses of it. We are focusing the prescription on patients who have received stem cells transplants. We don't have the data of the efficacy yet. For elderly care home, different medical clusters have their own practice. All along, our outreach teams, especially in the fifth wave, have established close partnership with elderly care homes. We still have sporadic cases from elderly care homes. We want to first confirm the infection status of the patients before we take actions. Outreach teams are offering a lot of assistance to elderly care homes, and they are our first contact with the elderly residents. For stable patients, they would be sent to isolation centers or the North Lantau facility. For patients with complicated situation, they will be sent to hospitals. Now, on elderly care homes, the CHP and the social welfare departments and the HA have all along required care homes to immediately report to us any positive cases so that we can perform infection control and investigation. During the fifth wave in Hong Kong, elderly and care homes for elderly people and persons with disabilities, there have been a lot of infections. Towards the end of March, when the situation eased, we stepped up infection control and prevention measures for the care homes. This is very important. Once the residents are imported, there is a extremely high risk of complexities, of complications and deaths. So this is very important for us to find out the cases as soon as possible to reduce deaths and serious cases. So staff members and residents in care homes have to take a RAT every day so that the care homes can find out possible cases as soon as possible. It is also possible that staff members bring the virus into care homes from the community. That's why we require RAT every day for staff and residents. The purpose of the online reporting platform is to enhance the efficiency and make it more convenient to report cases to us. Even if there is no positive case, a RAT performed by staff members and care home residents can also allow us to have the latest information of care homes. We encourage care homes to report to us the test performed every day. Next question. I'm from Cable News. There are online rumors that Mr. Leung Kwok-hong has been infected with COVID in the prison, and he needs to stay in ICU. Is that true? We don't have any information about that. Next question, please. Hong Kong 01. Now, social distancing measures and flights are relaxing. We have more imported cases recently. Dr. Au said the situation is stable, but do you expect a rebound? Now, according to WHO, BA.4 and .5 leads to many more cases, and also they can avoid, they won't be prevented by the antibodies developed after infection, and it may lead to a new wave. So how would you assess the situation? Do our vaccines have enough protection against these strains, and do we have safeguards against them? And recently, we have a chronic disease. Patients with chronic disease pass away during quarantine. So what is the arrangement for quarantine for chronic patients? Is it because of the shortage of manpower which leads to these incidents? Thank you. First question on social distancing measures. The situation is stable. The government has announced that once the situation has eased with a persistent downward trend, social distancing measures would be gradually relaxed in phases. Of course, there would be risk pertained. We will closely monitor the situation. Relaxation of social distancing measures is not a one-off step. There will be phases. We will carry out risk assessments of the trend to see if there is a rebound. The government and the CHP will closely monitor the situation. In terms of guarding against importation of cases, we are concerned about imported cases. Despite the relaxation of flight bans and allowing non-Hong Kong residents to come to Hong Kong, we still maintain the strictest quarantine measures. Travelers have to be tested and quarantined at a hotel. When there are positive cases, they would be isolated in isolated facilities. They will not be allowed to isolate at home. The samples will be tested for the genomes as the laboratory for any new strains. After leaving the hotel on the 12th day, they need to do another test at community centers. Unfortunately, if there are new strains, we can catch them before they enter the community. In terms of new strains, the WHO has issued some new information. According to the latest update by the WHO, there are 3 Omicron variants or subvariants, seeing increased occurrence in other places. So these subvariants may lead to a change in the characteristics of the virus, and it may affect the efficacy of vaccines. Still, there is no concrete scientific data to support or to show whether these variants would affect the efficacy of vaccines. These include a BA.4, BA.5, and BA.2.1. According to initial information, the patients infected with these variants do not have higher risk in terms of admission to hospital, complications, or death, according to evidence at present. Still, more data has to be gathered to monitor the development. In Hong Kong, for each and every imported case, we would perform genome sequencing to catch any possible new variants.
有冇其他提問？
Any questions? Well, this concludes the press briefing.
Hi. 呢個情況都幾常見嘅急症室啊，咁當然有陣時佢會有家屬嚟補翻啊，咁我哋有陣時就可以核實翻咯嚇。男性。